Do you use CPT in your day-to-day coding activities? And do you code in the 30,000 series of code? Hello, I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder.
Today, let's look at the CPT 2018 updates for the cardiovascular system, starting with the heart and pericardium. The parenthetical notes that follow codes 33367 through 33369 have been revised to allow reporting of transcatheter mitral valve implantation or replacement, code 0483T and 0484T. In addition, the parenthetical notes that follow code 33419 have been revised to specify repair of a transcatheter mitral valve 0345T and refer to the new codes for transcatheter mitral valve implantation or replacement. Refer to the code book and the rationale for codes 0483T and 0484T for a full description of the changes. In support of the changes in reporting endovascular repair of abdominal aorta and or iliac arteries procedures, codes 34714, 34715, and 34716 have been added to the guidelines regarding open arterial exposure in the endovascular repair of descending thoracic aorta subsection. Refer to the code book and the rationale for codes 34701 through 34713, 34714, 31715, and 34716 for a full description of these changes. Category 3 codes 0051T, 0052T, and 0053T, which were used for reporting artificial heart system procedures, have been deleted and replaced by Category 1 codes 33927, 33928, and 33929. Category 3 code 0051T has been converted to Category 1 code 33927 to reflect standard practice. Category codes 0052T and 0053T have been deleted because they are not applicable in practice. Code 0052T was previously used to report repair or replacement of the thoracic unit of a total replacement heart system, and code 0053T was previously used to report replacement or repair of implantable components. These are no longer applicable because in current practice, the entire heart system is most often replaced, rather than replacing or repairing the components. Therefore, code 0052T and 0053T have been replaced with codes 33928 and 33929, which should be used to report removal and replacement procedures of a total replacement heart system. In accordance with the deletion of codes 0051T, 0052T, and 0053T, appropriate new cross-reference parenthetical notes for reporting these new procedures, as well as references to other procedures, have been added. In support of the changes in reporting endovascular repair of abdominal aorta and or iliac arteries procedures, the exclusionary parenthetical notes that follow codes 33954, 33958, 33962, 33969, and 33984 peripheral cannula services, and 33987 arterial exposure with graft conduit creation, have been revised to include endovascular repair of abdominal aorta and or iliac arteries codes as appropriate, to clarify that these codes may not be reported together. Endovascular abdominal aortic aneurysm repair codes 34800 through 34806, 34825, 34826, and 34900 have been deleted. 16 new codes, 34701 through 34713, 34714, 34715, and 34716 have been added, and 4 related codes, 34812, 34820, 34833, and 34834 have been revised. A substantial number of new guidelines have been added, and parenthetical notes have been added, deleted, and or revised to assist with correct reporting of these services. The endovascular repair of abdominal aortic aneurysm subsection, which houses the codes, has been renamed as endovascular repair of abdominal aorta and or iliac arteries in order to accurately reflect the vascular anatomy treated using these procedures and to avoid limiting the type of injury to aneurysms. These changes to the reporting were prompted by the identification of codes 34800 through 34806, 34825, and 34826 on the AMA RUC-RA screen for services that are frequently billed together. It was subsequently determined that the entire family of codes should be revised to reflect current practice and technology, and to bundle services that are frequently performed together. The previous codes described treatment of vascular injury and were structured based on the type of device used. For example, code 34800 described endovascular repair of an infrarenal abdominal aortic aneurysm or dissection using an aortic tube, diagnostic imaging, i.e. angiography, and imaging guidance such as fluoroscopy performed in conjunction with the repair was reported separately, with codes 75952 through 75954 based on the type of imaging performed. The new codes 34701 through 34708 include more detailed description of the vessels involved and what is included in the procedures. They are structured based on the vascular anatomy involved and the type of endograft deployed. The new codes also distinguish between endovascular repair with rupture and for other than rupture. This distinction is based on evidence that repair of a ruptured vessel will involve more complexity, intensity, and work, including placement of a temporary aortic and or iliac occlusion balloon when necessary. This balloon would be inflated if the patient goes into hemorrhagic shock. Endovascular repair of ruptured vessels, for which this additional work is performed, is reported with codes 34702, 34704, 34706, and 34708. Endovascular repair of the infrarenal aorta and or iliac arteries for other than rupture are reported with codes 34701, 34703, 34705, and 34707. The new guidelines address this distinction and should be reviewed carefully before a code is assigned. Services that have been bundled into the new codes include angioplasty and stenting performed within the treatment zone, placement of endografts, placement of extensions in the aorta from the renal arteries to the iliac bifurcation, non-selective catheterization, and radiologic supervision and interpretation. These bundled services are not reported separately. Prior to 2018, there was no definition of treatment zone in the guidelines. For 2018, the new guidelines include a definition. Treatment zone is defined as the vessel or vessels in which an endograft, including the main body, docking limbs, and or extension is deployed. Procedures performed outside of the treatment zone, such as angioplasty or embolization, may be reported separately. This means that when an endograft terminates in the common iliac artery, any additional treatment performed in that artery is not reported separately. However, treatment that is performed in the external or internal iliac artery may be reported separately. The new guidelines regarding the treatment zone provide clear instructions about when it is appropriate to report additional procedures, and these should be reviewed carefully when these procedures are reported. These procedures involve the time-intensive preoperative work of sizing the aneurysm and selecting the appropriate type of endograft to be deployed. However, the previous codes did not clarify that this work was included in the procedure, and it was unclear whether or how this work should be reported. Procedure sizing and device selection are part of the pre-service work. For 2018, the new codes specify that this work is included. Add-on code 34709 describes placement of an extension prosthesis distal to the common iliac artery or proximal to the renal artery, which should be reported in conjunction with codes 34701 through 34708 when performed. An endograft extension that terminates within the common iliac arteries is included in codes 34703, 34704, 34705, 34706, 34707, and 34708, and is not reported separately. Codes 34710 and 34711 describe delayed placement of an extension prosthesis. Code 34711 is an add-on code and is reported with code 34710 for each additional vessel treated. Codes 34710 and 34711 should not be reported with code 34701, 34702, 34703, 34704, 34705, 34706, 34707, or 34708. So that would be codes 34701 through 34708, or with code 34709, because delayed placement of the extension prosthesis is not performed at the same operative session as these procedures. Code 34712 describes delivery of an enhanced fixation device to an endograft, such as an anchor, screw, or tack. It is reported once per operative session, regardless of the number of fixation devices deployed, and it includes radiological supervision and interpretation. Add-on code 34713 describes percutaneous access and closure of the femoral artery for delivery of an endograft through a sheath of 12 French or larger. Code 34713 may be reported with codes 33880 through 33886, 34701 through 34708, and 34841 through 34848 as appropriate. Code 34713 is not reported separately if a sheath smaller than 12 French is used. Open arterial exposure is performed during endovascular repair of abdominal aorta and or iliac arteries procedures when a vessel is too small in diameter to accommodate passage of the endograft. Changes have been made to the reporting of open arterial exposure performed for delivery of endovascular prosthesis in these procedures. Prior to 2018, the existing open arterial exposure codes were standalone codes, and some limited the endovascular prosthesis to the aortic or iliac type. For 2018, the arterial exposure codes have been revised with the designation of add-on code and the removal of the restriction to the iliac or aortic type of endovascular prosthesis where appropriate. Code 34833 has been further revised to describe arterial exposure for establishment of cardiopulmonary bypass. Codes 34714 and 34716 also describe exposure for establishment of cardiopulmonary bypass. In addition, new add-on codes have been established to describe open exposure of the femoral artery and axillary subclavian artery. Codes 34812, 34820, 34833, 34834, 34714, 34715, and 34716 should be used to report unilateral procedures. Prior to 2018, bilateral arterial exposure was reported by appending modifier 50 to the appropriate code. For 2018, this instruction has been replaced with the instruction to report the open exposure add-on code twice when it is performed bilaterally. It is important to review the guidelines and parenthetical notes carefully when reporting the open arterial exposure codes.
Are you interested in the field of medical coding? Well, we offer an online medical coding course just for you. Click the link in the description box below for details on our online medical coding courses. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care.